we're still operating as county government, although we're doing it in a much more scaled back capacity. Most departments have someone on duty that can still handle public response, talking to the public. Obviously, we have some 24-hour departments who have to be on duty or on duty all the time, like the prison, like the 911 center, like our youth intervention center. And I just really appreciate what they're doing. They continue to work for the public. But the other departments, if somebody in the public needs something, I would urge them to check the website first. As of Monday, this building will be shut most of the time, although if you have an appointment with the department, you'll be able to get in, and we'll also still have to have public meetings from time to time.
And can you speak a little bit more to the mandate from Governor Wolf last night and how that's going to affect Lancaster County?
Well, I think the enforcement of it is a little unclear and how that's going to work. I will say, I'll just concentrate on the voluntary social distancing. And I think everybody wants to do the right thing. I think people across Lancaster County are trying to. When you look out the window, you can see the streets are a lot more empty than they were. So I think people want to do the right thing. They're trying to do the right thing. They understand the seriousness of this, and that's what I'll focus on. I think Lancaster County does collaboration, does helping each other better than almost any community in the country, and that's what we're doing right now.
And what is the Lancaster County government doing to prepare if there's a surge of patients coming into the city hospitals?
So we've been working on collaboration with the hospital since the beginning of this. Our emergency management team, which is great, is working all the time on this to collaborate with the Department of Health, with PEMA, which is the Pennsylvania Emergency Management Agency, and then with our hospitals and medical providers. We all want to work together and be on the same team and same page with this. Obviously, what everyone's trying to do is, and you've all probably heard this, is flatten the curve so that there's not a giant surge of patients into the hospitals. And if that happens, the hospitals have been working very hard on contingency planning. I just talked to one of them. I was on a conference call this morning with the countywide EMS provider. So everybody is very focused on this. They have plans for it. I think they're prepared, so I think we'll be ready.
Are EMS providers taking precautionary steps during any response that they might go out on, knowing that somebody could have come in contact with COVID-19?
Yeah, they are, and the 911 center is trying to provide them that guidance ahead of time if they get that information. I think that's what is important. If they can get that information ahead of time, that's important. But yeah, they're taking steps. They're talking with the doctors who can advise them on, exactly what is the standard. That's a concern. EMS is the people that are on the front lines of this, and I think we all just should thank them and keep them in our prayers going forward, because if this gets really bad, they are the ones that are going to be on the front lines, as well as doctors, nurses, everybody at the hospital. So they're the ones we should really be thinking about and trying to protect by minimizing this.
And are there any steps being taken to help those that are in a vulnerable position, such as the homeless and people that might have a low income situation?
Well, there's a lot of different vulnerable populations. One is the elderly, and you saw the steps with obviously restricting access to retirement communities, nursing homes, which we have a lot of in Lancaster County. The homeless, there is active outreach going on to the homeless. You saw, appreciate the city and the mayor was working on the hand washing stations. My colleague, Commissioner DiAgostino, has been in collaboration and in touch with the Homeless Coalition, which is an organization that has outreach to them all the time, but that's more important right now. And certainly anyone who's experiencing issues with not being able to get out to get food, 211, you can call the 211 system, and they can provide some resources there. Certainly there's county agencies that can help with that as well.
And the election, a lot of polling locations are in retirement communities. What are we doing to combat that?
Yeah, so our elections director, Randall Wanger, has been working on this very hard to, I think he has said that not only does he have backup plans, but he has backup plans to the backup plans. My colleague, Commissioner D'Agostino, who's the chair of the election board, is also working on this because there's some question about whether the primary election will go on, and that'll have to be decided by the governor and the state legislature. But as of right now, the primary election is still set, is still going to go on in April. If that changes, we'll be flexible and go with that, but for now they need to prepare for it.
And what is your message to Lancaster County as a whole?
I think people are worried, rightly concerned. This is a serious situation, but you know, I keep saying we're Americans. We've been through worse than this. We can get through this together. There is no community that collaborates better than Lancaster County. We need to count on each other now, and we are. And I think this community is coming together like never before, and we're going to be all right. We're going to get through this, but we need to work with each other. We need to be patient with each other. And you know, take care of yourselves physically and mentally, and we're going to be okay at the end of this.